Hi, I'm Rae Anne McLaughlin, and I'm here today with Erin Gurd. She's a registered dietitian at Moffitt Cancer Center. She's been there for 8 years, and she specializes in the prevention of malnutrition in seriously ill patients. Hi, Erin. How are you today?
I'm great. Thanks for having me.
This is such an important part of the palliative care model, nutrition. I am in 5 years of recovery with stage 4 head and neck cancer. And I can share with you that this was the most difficult part of my treatment. Staying hydrated and healthy during treatment was really stressed upon. And it wasn't until the nutritionist piece was pushed into my care that I really understood how to do it and how to make that piece work.
Yeah, so nutrition can make a big difference in treatment. Number one, it often will prevent delays in treatment. So if you are very ill, you've lost too much weight, you're just not strong enough to continue. And so often a delay in care can happen where you're admitted to the hospital, or we just have to stop treatment for a little bit to give you a break to make sure you're able to regain strength. And so if you are continuing with good nutrition, able to maintain strength and weight, often you can continue treatment without delay or end up in the hospital because of malnutrition that's occurred.
Got it. Got it. So what I'm hearing you say is that nutrition is just as important part as if someone is having chemotherapy or radiation or any other part of the significant cure to whatever is ailing them, or treatment to whatever is ailing them. When you're in the middle of treatment, sometimes that's when your nutritional needs start to pop up. You're getting treatment that maybe you're not so hungry, maybe you can't keep anything down. When would that be the appropriate time to ask your treatment team to push some kind of nutritional consultation in?
Yeah, so we often recommend when you've lost about 5% of your weight in a month, that's when we consider you at malnutrition. And I mean, ideally, it would be better to ask for nutrition before that happens to prevent the malnutrition. Once you've hit that malnutrition marker, it's a lot harder to get you back. And so really at the very beginning of treatment would be one of the best places to start seeing the dietitian, so we can prevent that further weight loss, get you nice and strong, maybe even gain a little bit of weight before treatment starts, so that if you do lose weight, we kind of had planned for it. So it's not as big a deal if we've lost weight we've planned to gain.
In an ideal setting, every hospital, every treatment center has a nutritionist involved in your team. If you're not fortunate to have that, are there places that you can go to kind of seek out care?
Yeah, that's a great question. Not all places do have dietitians. I know my facility has, we have a very large amount of dietitians, but I have patients I see from outside facilities that never saw a dietitian, lost 70 pounds of body weight, and they never saw anybody. The Academy of Nutrition and Dietetics has a great website. It's eatright.org. On there, you can type in your zip code and they will give you a list of registered dietitians in your area.
Great, that's fantastic information. Thank you. When we talk about care as you're going through treatment, we know that you're pushed in, if you're fortunate to have that in your treatment modality. What about after treatment? After you go home, after you're back to some sort of a normal life? I know many people with head and neck cancers or esophageal cancers sometimes go home with tubes, sometimes go home with feeding tubes, tracheas. Where does dietitian and nutrition come in that part of treatment?
So, you know, once you have the tube, trying to make sure you're doing okay with your tube tolerance, making sure you're tolerating the tube feeding, because there's lots of different tube feedings on the market and not everyone's going to tolerate the standard. So making sure you're not having excessive diarrhea or vomiting or gas discomfort from that tube feeding, or, just if you go home and you don't have a tube, making sure you're eating enough protein for recovery. I know you had radiation. Eating adequate protein can really make a big difference on healing that area that was really irritated during radiation. So pushing that protein intake, making sure people are tolerating the tube feeding or diet that they're on.
And is this something that will carry on long after treatment? Can patients access their nutritional services a year, 2 years out?
I know here we have a survivorship program. So patients continue to come here after they're done treatment to make sure you're still doing okay, you're not losing excessive weight. You can always see a dietitian. We do have a dietitian in the survivorship clinic too, that patients can come to if they need help in regards to weight loss or weight gain, depending on what's happening after that treatment's concluded, because that's often a big issue. People go home and we say bye and you don't see anybody anymore and you keep losing weight, or, I have this tube, when can I take it out? Am I done with it? So we do have dietitians that see someone in that clinic. And then, I see patients in survivorship as well when they're done, trying to make sure they're strong enough. We're eating a healthy diet to prevent, relapse or more issues with health later.
Great. That's great. I know for myself, the nutrition dietitian piece was really helpful for me to get to speech therapist and a swallow specialist. So can you talk about the other specialties you may be able to add to a patient's care that maybe the oncologist or the radiologist isn't thinking about?
Yeah, speech therapy, we work with a lot, of course, as a dietitian. They're in the same office as we are, so it's great because we can talk to them all the time. PT and OT, so physical therapy, occupational therapy, huge when trying to recover. You've lost a lot of muscle, and trying to get that strength back is so hard. The nutrition can help, but the movement really needs to come into play as well.
Right.
And then, of course, we work with social work really closely as well. You go home with a tube, we're trying to get you home care and everything. And social workers here are great with helping to make sure everybody has good home care for tubes or physical therapy, getting to the hospital and transportation.
Right. That's great. And, now that we're dealing with COVID and the limitations that COVID puts on us, you're meeting with clients and patients. Is that something you're able to do remotely if people are a little hesitant to take extra trips to their center?
That's a great question. That is a huge thing now in nutrition. We used to see everybody here in the facility, and if I couldn't see you that day, it was kind of, oh, well. Now, because of COVID, it's really pushed telehealth to the forefront. And I'd say more than half of the people I see now are telehealth through Zoom or whatever platform you have at your facility. It's excellent. Keeps people from not wanting to come to the hospital. A lot of times patients come here and they are exhausted after seeing the doctor, and they don't want to wait around for me, even though I'm wonderful, right?
Absolutely. Absolutely.
But they're exhausted, so they can still go home and just talk to me another day when they're in their own home, comfortable, not feeling terrible. It's wonderful.
Great. That's great. And I know, and I always like to add this when I'm doing these interviews, there isn't anything you can't talk to your nutritionist about, right? I know there's a lot happening in one's body when they're going through treatment. I remember one of the first things my nutritionist said was, I want to talk about what's going in, what's going out, what's happening in the middle. That's what I'm here for. And I think once I heard that, it allowed me to take a breath and say, okay, what's happening to me may not be normal in my everyday life before being sick, but it's not anything you haven't heard.
Definitely true. A lot of people that don't know what I do ask, oh, do you talk about supplements a lot? And I say, well, I really talk about the stuff that comes out the other end more often.
Right.
That's it's number one thing I talk about. And I do find that sometimes, the doctors are wonderful here, but they see a lot of patients and they're talking about a lot of different things. And so when someone comes to see me, they have more time to discuss what's happening and they feel more comfortable talking about it with me because we have a full hour to talk about whatever you want to talk about. And a lot of stuff can come up during that time that maybe they forgot to mention to their team. So it's great to have that and they can talk to me about whatever they need to talk about.
And how connected are you with the rest of the team? So if I was to bring something up to you and say, oh my goodness, I forgot to tell my oncologist that, you're able to then relay that message if you feel it's important to him or her?
Absolutely. So my job is really nice in that I actually work in the same clinic as the physicians and the APPs. So, and we have a pharmacist in the clinic too. It's wonderful.
Right.
So anything that you bring up to me, I actually just walk across the hall. The doctor's sitting right there. Or if they're not in clinic that day, email them and they get back to me really fast. So it's a wonderful team that we have here.
That's great. You just mentioned the pharmacist, which leads me to ask you about the different medications that patients are taking and those side effects. Maybe your appetite isn't as great. Maybe your appetite increases if you're on the steroids, prepping for treatment. You're knowledgeable in all of that area. And as things come up, you're able to convey any changes or significant changes to the rest of the team, which makes you an invaluable piece of the palliative care puzzle. Tell me a little bit about when it's time to start asking for some nutrition consultations and help in that area.
Honestly, right at the beginning of treatment is the best time to start really looking at your nutrition or speaking to a dietitian. It can help prevent that malnutrition piece. Once you've lost about 5% of your body weight in a month, we consider that malnutrition. So if you've gotten to that point, we really do recommend seeing somebody, dietitian, palliative care, to help with that weight loss.
Right.
Anytime you have reduced appetite too, you just notice you just can't get yourself to eat the food as much as you used to. Things aren't tasting as normal. That's a great time to see the dietitian as well. That's a big trigger that, okay, we're not eating right and we're going to start losing weight.
Right. So when patients, I know chemo patients, typically things start to taste metallic and that really makes appetite suppress itself. So when I'm starting to feel those things, or patients are starting to feel those things, that's when it's important to say, hey, things are changing. I need some extra support.
Definitely. And the dietitians usually have some good tricks to help with those taste changes.
Okay, that's great. And lots of times there's family members that are a big part of care. Can they reach out to nutrition and say, listen, this is what my patient, family member, or friend is going through? Is it appropriate for them to reach out and ask for help?
They can ask for help if the patient is going to be in the same room. So, if they want an actual dietitian consult with, calories and protein and different strategies, it's really beneficial for the patient to be there. Right. Often too, when you're going through treatment, I feel like the caregiver takes on a lot of burden for trying to push that food, and that can become a difficult relationship, right? Your family member loves you, they want you to eat well, and you just don't feel like it and you can't do it. But having an outside person say it sometimes takes that burden off the caregiver. So having, that patient there at the meeting is important.
That's great. That's great. And then when in the palliative care model, where does nutrition come in and how does it benefit from start to finish getting the patient to their ultimate goal?
So it depends on the doctor. The palliative care team here is really awesome. If they notice reduced appetite, reduced weight, they always put in a consult for me or one of the other dietitians to see the patient. They'll definitely kind of give them some recommendations first and then say, I really think, have you met a dietitian here? We've got a great team. And they'll put that consult in so that I can see the patient and get them eating better, maybe even prevent some more weight loss. help with quality of life, nausea and taste changes and fatigue is really huge. And eating a better diet or eating more protein can really help with some of that quality of life part.
Right. Yeah, that's very important. And I think it's also really important to think about what the nutrition piece does as you are starting to regain some normalcy in your life. I remember, after 35 radiation treatments and 15 chemo treatments, my body was pretty much turned to jelly. And nutrition was a big piece of me building muscle mass again, working on muscle tone, rebuilding, a shape opposed to just a non-shape at that point. And that was all through the nutritionist at my center. So it really just plays a huge part in the entire treatment process from start to finish. Well, thank you so much for joining us today. This has been a great series. I really appreciate your time. And I look forward to doing this again next time.
Thank you.